So welcome everyone to this event in the context of the International Forum Wellbeing and Subjectivities across the Global South. This panel is going to be on pages, zines and dating apps, queer community media and health communication in China. I'm really happy that I'm going to be in conversation with Hongwei Bao and Zairong Xiang here in this panel. And for me, it's also in one of the first times, surprisingly, that that I'm doing this under these conditions. So yeah, so to all you in the audience, a warm welcome. I can only see you, or we can only see and experience you as names on a list, but that doesn't mean that you know, we don't really appreciate you being here. And just before we start properly, a few remarks on how we're going to proceed with this. So basically, there's going to be a first longer part of input where I'm just going to say a few words of how this came about, and then Hongwei is going to give a talk. Zairong's going to respond to this, and then I'm going to engage with the two of them in a little discussion. And then after that, we're going to open up the discussion to you, to the audience. And the way we're going to do this is that I'm going to ask you after the whole thing to write your questions into the Q&A function. I don't know if any of you have used it before. So my first request would be for you to not use the chat function, but I think you can't because I think it's been disabled. And also please wait with using the Q&A function until the first part is done. So I'm going to say, I'm going to ask you when we're ready to receive your questions, just so that not too many questions accumulate over the course of the talks. And then I'm going to try and moderate the questions and pass them on to Hongwei and Zai. Yeah, so that's for the technical side of things. We're really hoping that our connections are going to be stable and we don't experience any major issues. Right, so about today's event, I think so to me this feels really special because in the context of the larger Global South Summer School on these two ideas of well-being and subjectivities, I think this to me feels like a crucial event because I think in a lot of places all across the globe there have been really important debates about the current situation, so the current pandemic, and how the pandemic has impacted people really differently depending on who they are, how they are positioned, what kind of subjectivities they inhabit, and what kind of groups they belong to, and how processes of othering shape societies across the globe at the moment, and how inequalities become worse in the current situation. So I think many of us have been looking at these developments from an intersectional perspective, through the lens of feminism, through the lens of queer studies, through the lens of anti-racism, and Hongwei is obviously a specialist on queer community media and health communication in the Chinese context, and I'm really glad, Hongwei, that you were prepared to kind of use your expertise and then put it in conversation with the current situation. So before I hand over to you, I would like to introduce our two speakers quickly. So first of all, there's Dr. Hongwei Bao. He's Associate Professor of Media and Cultural Studies at the University of Nottingham, where he's also co-director of the Center for Contemporary East Asian Cultural Studies. He received his PhD in Gender Studies and Cultural Studies from the University of Sydney and has held positions in Nottingham, Potsdam, Sydney and Beijing. He's also received fellowships from, for example, the DAAD and the British Academy, and he's the author of Queer Comrades, Gay Identity and Tongji Activism in Post-Socialist China, which came out in 2018, and most recently, Queer China, Lesbian and Gay Literature and Visual Culture under Post-Socialism. There it is, and it has only just been released by Routledge in May, right? I think, yeah. And he's currently already working on a new book, as I understand it, on queer community media in China. So that's Hongwei. And then we've got Dr. Zairong Xiang, who is Assistant Professor of Comparative Literature and Associate Director of Art at Duke Kunshan University. Zairong received his PhD in Comparative Literature from the Universities of Tübingen and Perpignan in the context of the Erasmus Mundus Joint Doctorate Cultural Studies in Literary Interzones. And he's held postdoctoral positions at the ICI Berlin and the University of Potsdam. He's the author of Queer Ancient Ways, a Decolonial Exploration, which came out with Puncton Books in 2018. And he has co-edited two special issues. One is called The Ontology of the Couple, which was a special issue with GLQ, the Journal of Lesbian and Gay Studies, and Hyperimage, which was a special issue for New Art, which also came out in 2018. He's co-curating the 2020 Guangzhou Image Triennale, and he's currently working on two research projects dealing with the concepts of transdualism and counterfeit in the global south, especially in Latin America and China. So I'm really excited to have the two of you here. And without saying anything else, I'm handing over to Hongwei and your talk on Pages, Zines and Dating Apps, Queer Community Media and Health Communication in China.
Mm-hmm. Thank you very much. Thank you, Gero, for your kind introduction. Danke für die Einladung. So the topic that I proposed for today's talk was actually proposed several months ago when, well, coronavirus wasn't that rampant. So I didn't take into account the current situation. But now, since we are in a global pandemic, it is actually useful to reflect on how our research relates to, at least how my research relates to the current coronavirus and what we can learn from past experiences. So my research primarily focuses on queer cultures and communities in China. And at the moment, I'm writing about kind of a history of queer community media from 1980s to present. So that inevitably raises a question of why do we study community media? What's the importance for community media for a kind of public health crisis like this one? So that's going to be my starting point. I know that a lot of people think that HIV/AIDS and gay community is a kind of, well, has been closely related in gay history. However, it has been a past. However, I suggest today that there is a need to look at that historical past, and then we can learn something about how community can respond to different types of health crisis. So I'm now going to share my screen. I hope that you can see my PowerPoint slides in a minute. Is that working? I suppose so. Okay, so queer communities' response to the AIDS pandemic. So my starting point is what lessons can we learn from China's queer history and from the history of AIDS pandemic? And I'm going to first actually compare and contrast the two pandemics. And then by tracing the responses to HIV/AIDS in China, and especially among China's queer communities, I'm going to look at the lessons we can learn and highlight the importance of community response and the use of community media in creating what Foucault calls reverse discourses. So COVID-19 and HIV/AIDS, what do they have in common? So since the beginning of the pandemic, a lot of scholars have done some comparisons or have tried to compare the two pandemics. Of course, they function in different ways. Of course, they affect different groups of people, yet they do have something in common. So both pandemics affect minority communities and vulnerable communities the most. Well, when we talk about HIV/AIDS, we can think about gays and lesbian communities were affected severely in the 1980s and 90s. And in the current COVID-19 pandemic, at least in the UK context, Black and Asian communities were often vilified and seen as scapegoats. I remember even a couple of weeks ago, when I was working in my small town, I was spat at by people, by strangers. So this is a kind of real situation. In a pandemic, people need to find some scapegoats, and minority communities are usually seen as the kind of folk devils that can create the kind of moral panics. And both pandemics highlight the importance of sustained government and public health interventions. Some governments perhaps do better than others, but in all the situations that I've seen, the government responses pretty much reflect the kind of long-standing structural inequalities in societies, whether it's racial inequalities or inequalities in terms of gender, sexuality, and so on. So those inequalities really are perpetuated in the pandemic and erupted in different forms. And both pandemics affect people's relationships and intimacies in different ways. We now actually have to see people in different ways, interact people in different ways. The online environment is good because it can bring us together, but there is a kind of lack of physical intimacy in such a pandemic environment, which affects gay people as well as straight people alike. So we may think that the current pandemic is probably the most serious one that we have experienced. But if we look at it from a long historical perspective, then we can see that in fact it's not. Of course, I recognize that it is an ongoing and ever-evolving picture. The COVID-19 pandemic is not over yet, so it's too early to say whether it's serious or not. But if we look at the statistics from at least before April the 20th, we can see that, in fact, COVID-19 pandemic is actually one of those small pandemics that has affected mankind in history. And the biggest or the most serious ones is actually the HIV/AIDS crisis. Most people don't think about it this way because they haven't affected us, they haven't affected mainstream society, and they haven't affected what I would say heterosexual majority, middle class that much as they affect minorities. So when a pandemic affects minorities, it's always seen as not so serious, not worth paying attention to. That was why when COVID-19 struck China since January or since last December, the Western world pretty much turned a blind eye to it because it is the disease of the other. It is a problem of the global South. And presumably it won't affect the global North, but only when it touches the lives of the global North that people, including intellectuals, philosophers, have started to take that seriously. Okay, so I also want to suggest that most people have a false impression that HIV/AIDS crisis is over. It's not. So according to the UN AIDS statistics from last year, so even last year, if you can see the statistics here, 1.7 million people became newly infected with HIV/AIDS in 2019. And 690,000 people died from AIDS-related illnesses last year. So it was a huge number and it hasn't stopped. But why do we stop caring about AIDS? This is a question that is worth asking because it affects certain communities more than others. Or in particular, at the beginning of the AIDS crisis, AIDS was seen as a gay disease. If it affects the gay communities, then presumably mainstream societies wouldn't care that much. But of course, HIV/AIDS has a long history. Well, the first case was reported in 1981 at New York Times. And it took the US government a long time to respond. And HIV/AIDS activists or gay activists had to act up, had to create a lot of protests and had to lobby the government in order to create a response. And eventually, the government responded, the big pharmaceutical company responded, and sustained public health policies were created. So this highlights the inequality of the pandemic affected people. This also highlights the importance of activism, especially community-based activism in combating or coping with a global pandemic. And the history of HIV/AIDS in China is pretty much similar but different from the case in the US or in German context. And the first Chinese case was reported in 1985. That was 4 years later after the New York Times case. And it was a foreigner. So that created an impression that it's a foreign disease. So for a long time, the Chinese government has responded to it as a kind of disease of the other. If we actually were enforced, well, the idea was that if we enforced strict controls in terms of immigration, in terms of testing foreigners, then presumably this wouldn't happen. But of course, this is not true. But before we actually delve into the history of HIV/AIDS in China, I would like to go through some of those statistics. So from 1985 to 2015, so we can see the growing trend. The big blue column is heterosexual transmission or transmission among heterosexuals. And the red bits are transmissions among homosexuals or between men who have sex with men, MSM. I'm going to use this abbreviation a lot because this is a kind of medical and social public health jargon used often in different contexts. So strangely, you'll see that actually the rise of HIV/AIDS cases among heterosexuals are much higher and more alarming than the gay groups. However, the blame is always on gay people or homosexuals. So of course, we recognize that there is a growth of HIV infections among same-sex attracted people or men who have sex with men. And it didn't start until 2006. As we have learned from this global pandemic, statistics do have a lot of politics, or we need to look at statistics more clearly. I know that Donald Trump has a famous saying, which is very notorious, which is that slow down testing because the more tests, the more figures that you have, etc. And this is actually a problematic statement. But there is a little bit of reason actually in his argumentation, which is that statistics only count when we start counting it. If we don't count this group of people, then presumably the people don't exist, the problem doesn't exist. But of course, the problems always existed. And all we need to do is to pay attention to those ignored or neglected social groups and start counting them. So that also suggests to us that before 2006, the homosexual population or MSM were not calculated in official statistics. But why was it? Okay, so if we look at the kind of official defined 4-stage reaction or responses to HIV/AIDS, stage 1 AIDS was considered to be an imported disease. And after the discovery of the case and some regulations were designed by the Chinese government, one of them was stopping importing blood products from overseas and relying on blood products from inside China. But then that created another problem, which is that in China's medical care system, a lot of blood banks were not well regulated. So that meant without HIV testing, well, people can simply actually donate blood to the blood bank and then pollute or contaminate the whole blood bank. So that creates a big problem. And that problem, what really escalated in stage 3 between 1994 to 2001. Oh, before this, we also had AIDS as a peripheral problem in China's borderline regions, especially with kind of drug trafficking and drug use and so on and so forth. But it was still the problem of the other. As long as a pandemic is seen as a problem of the other, it won't attract too much government attention. And stage 3 is different because it started to affect the blood contamination, started to affect most Chinese provinces. So in this period, all of China's provinces had reported HIV infections because of blood contamination. So this was getting serious, and Chinese government were facing a lot of pressures. And then this was also the stage when international support, especially international funding from Global Fund, UNAIDS, and so on, stepped in. And stage 4 from 2001, people started to recognize that HIV/AIDS were transmitted through sexual transmission, among other means. So that was the period of sexualization of China's HIV/AIDS. What the government started to think about some key populations. Of course, gay population was considered to be one of those key populations, and with sex workers and so on. So in other words, sexuality started to be taken seriously in Chinese government's responses to AIDS. That happened to be the period when gay identities and communities emerged in China. Okay, so going back to the stage 3, I talked about the blood contaminations actually through blood transfusion, through donation of plasma, and so on and so forth. So it took the government a long time to recognize it. At first, there was kind of attitude of denial, and then civil society groups, activists, and international organizations started to exert pressure on the government. And there needs to be a shift of discourses during this period of time. So apparently, according to international experience, especially experience from US gay populations, and sexual transmission has always been the major way of transmission. So the attention began to be shifted strategically or coincidentally to the gay populations and to sexual means of transmission. And here, we'll recall that I talked about the statistical problem pointed out by Donald Trump. If you don't count, it doesn't count. And if you started to count, then things started to grow, then statistics grow. So according to Jeffries and Su, the dramatic rise in HIV/AIDS prevalence among Chinese men who have sex with men, or MSM, is a reflection in part of the expansion of sentinel surveillance, behavior intervention, and diagnostic testing. This doesn't mean that the problem didn't exist among gay communities or among homosexual communities, but this did meant that that problem has been amplified, has been put under a microscope and examined closely. So some statistics will help you understand the situation. In 2002, there was only one HIV sentinel surveillance site for MSM, men who have sex with men, otherwise known as homosexuals. But people recognize that not all people who have sex with men are homosexuals, are self-identified as gay. So hence the abbreviation. And then in 2009, only in 7 years' time, 17 HIV sentinel surveillance sites for MSM were set up. And then 3 years later, 108 sentinel surveillance sites for this specific population. If you start to count, again, things started to grow really dramatically. But of course, I also recognize that in real life, it was a real threat towards the gay population. Sorry. So that was kind of my alarm, but Okay, so of course, before this stage, before what we call the stage 4, a lot of activists, including queer activists, started to recognize the importance of HIV prevention in China's gay communities. And Wan Yanhai, as early as 1988, set up kind of AIDS prevention, education, and intervention in Beijing for gay communities. And in 1993, on the Valentine's Day, he even organized a men's world salon, which is kind of gay meetup group at that time, which was considered to be the kind of a landmark event for the emergence of homosexuality in China. So this was in the 1990s, but again, in the 1990s, the HIV/AIDS gay communities were not recognized in China's public discourse, let alone in the kind of public health intervention discourse. Something has started to change in 2003 or around this time. Around this time, China signed Paris Paris Agreement and decided to participate in the global efforts to curb HIV/AIDS. And between 2003 and 2014, Global Fund, short for the Global Fund to Fight AIDS, Tuberculosis, and Malaria, supported HIV/AIDS prevention and treatment schemes in China. And Global Fund is not the only scheme that helped civil society building and HIV/AIDS prevention in China. And there are other foundations such as Barry Martin's Foundation, Ford Foundation, and so on and so forth. So when international capital started to flood in China, Chinese government had to respond. One of the conditions for this kind of response, for the kind of international funding, was that the government needs to work with communities, and in particular, gay communities. Where do we find gay communities? As you know, in 2001, homosexuality was depathologized, and 1997 was decriminalized in China. So the homosexual community was pretty much an invisible community in China's urban areas. So you got to find those people. How do you find these people? Well, the best way, learning from the Western method, is to work with communities, to rely on the NGO, short for non-governmental organizations. So supported by global funds and supported by international foundations and in collaboration with Chinese governments, different types of MSM groups, or men who have sex with men, or HIV/AIDS groups, were founded to tackle the problem of HIV/AIDS in China. Here we have some statistics. So in 2009, among the more than 300 organizations, only 1/3 deals with MSM population or homosexual population. And in 2010, 50% of the organizations deal with MSM population. And then the population grows afterwards. So in 2014, Global Fund support stopped, and some of those organizations disappeared because of lack of funding support. However, by this time, in almost every city in China, there has been at least one LGBTQ organizations, sometimes disguised as MSM or HIV/AIDS organizations. So in other words, queer communities and identities have started to form within this historical context, supported by international public health aid, and partly supported, or at least consented, by Chinese government. Meanwhile, a lot of research, including survey, sociological research, has been done towards the gay population. For example, the article on the left-hand side, on my left-hand side, shows how mobile phone dating apps can tell us a lot about HIV infections among MSM communities. And the chart on the right-hand side shows homosexual communities, a group of people's sexual behavior, how long do they have sex, and where do they have sex, and what kind of sex do they have, and so on and so forth. Remember, all those research were supported by different agencies, by Chinese government, by international foundations, by China's national social science scheme, etc. So therefore, there was a proliferation of discourses and scientific research into the population, which people call MSM, men who have sex with men. So at this time, gay was pretty much equivalent to MSM, or MSM was the only possible way to talk about gay issues or LGBT issues during this time. So the kind of global political economy has produced subjects, particular type of sexual subjects. At this time, the sexual subjects was a kind of specific stigmatized and medicalized MSM identity. But that was not the end of the story. What was not yet dictated or not yet under control was the form that the communities and identities have started to take shape. For example, some identify with MSM, of course, but others don't identify with MSM. Some identify with 同志, a Chinese term for gay, and queer, LGBT, and so on. So these identities started to proliferate in this historical background. On the right hand, in the middle, you probably see transsexual as MSM, AIDS prevention scheme. So transgender, transgender is probably the best translation. So here, trans communities have also started to emerge within the public health intervention. And as I said, that people sometimes reject the stigmatized MSM identity. Instead, they create other identities or embrace other identities. They also articulate kind of anti-discrimination concerns. We are minorities, we are affected, but we shouldn't be discriminated against. There should be rights and policies that protect the minority rights. So, and also, during this period, we see the division, also formation of different types of sexual politics. Of course, some people stick to the kind of identity politics, follow the Western way of coming out and being proud and so on. But other social groups actually will adopt a queer politics or reflect on what queer politics might be like in the Chinese context. So there was also the division of sexual politics. So here we can see some unexpected outcomes that the global public health schemes have created, which is the proliferation of identities, communities, and even politics. So just a brief summary. So here I'm talking about the Chinese experience. So unlike in the West, that before the strike of HIV/AIDS, there was already a well-developed, in many countries, a well-developed queer communities or LGBTQ communities, and HIV/AIDS simply actually accelerated the process or shaped the politics in particular ways. But in China, the formation of identities and communities in the queer communities pretty much coincided with those public health interventions, with a response to HIV/AIDS. So in other words, the HIV/AIDS pandemic pretty much triggered and later accelerated the emergence of queer communities and identities in China. Of course, I recognize that MS identity is not the only identity that has been created. I also acknowledge that not every social group or a civil society organization deal with HIV/AIDS issues, and some organizations, especially lesbian organizations, probably actually they haven't benefited from this global AIDS scheme, and then they pursue their politics in different ways. But this again actually has shaped certain what we call characteristics of gay history in China, such as the division between gay history and lesbian history, the division between identity politics and queer politics, etc. And it's a complex issue, and it has a lot of parallels with many other parts of the world. However, I would talk about emphasize the notion of reverse discourse. Yes, those medical discourse and legal discourses and public health intervention discourses created certain identities. However, they cannot dictate the formation of that identity. And those identities and communities started soon to proliferate, to go beyond the kind of official limits. And in a way, we see that global political economy has a profound impact, but cannot completely determine biopolitical developments in the global south. I'm aware that the topic of today's talk is actually on queer community media. I'll talk about it briefly because of the time. So queer community media played a very important role actually in creating a kind of reverse discourse, in helping identities and communities to articulate, to understand themselves, and to take care of each other during a healthcare crisis, but meanwhile also during a kind of unfriendly environment, discursive environment in China, when LGBT issues could not be talked about openly. When they were talked about, they were often related to HIV, AIDS, etc. So those media forms will include leaflets, zines, hotlines, websites, and so on and so forth. I'll use some of the examples, 3 examples briefly. One example is the AIDS hotline in Beijing in 1992, created by Wan Yanhai, queer activist that I mentioned. He, as a public health professional, realized the importance of this community for HIV/AIDS prevention. So he set up, well, first he started to talk to people actually in parks and in public beats and so on, but people don't listen to him. Well, passing out leaflets wasn't very effective either. So the best way is actually to gather people together, to organize meetup groups for gay, or mainly gay men. And this became the foundation of the earliest form of gay organizing and the gay organization in China, which is called Men's World, as briefly mentioned before. And then lesbians also started a hotline, which is a pager hotline. Pager is probably kind of very archaic thing. Many of you probably do not know about or have forgotten. So basically at that time, so they have a pager number, and then the user or the customer or those who have questions will page that page number, and then you have to find a phone, public payphone to actually to answer that call, because at that time, a telephone is not a household necessity or household essential in many Chinese households. So that was in the 1990s. And then Xiang, some organizations, HIV/AIDS organizations, published newsletters and distributed them among the MSM populations and to government officials and public health experts. So one of the newsletter is called Aizhi newsletter. If you read Chinese, you know Aizhi is also homology to AIDS. So basically, you can see that this newsletter is very simple. It has some contact information, it has some basic knowledge, it has some Q&A sections, and then contact information. But it passes on some positive information about gay identities. It is about HIV/AIDS, but it's more than HIV/AIDS. So in other words, early gay activists and public health professionals use those AIDS newsletters to promote kind of recognition of gay identity and queer rights. And then there was a Friends Exchange, which also started as a newsletter, later became a zine. And this statistics is important because it gives you a sense of the widespreadness, of how widespread the magazine is. The development of the magazine's distribution network is pretty much a kind of development of the nationwide communities for sexual minorities. So it has work team in nearly 60 cities with 2,500 gay people in regular context, which means they are volunteering for this, either as distributors or as kind of contributors, etc. And they are also distributed to medical professionals, mental health professionals, Center for Disease Control, which is a government department, a clinical STD, and media professionals, etc. So apart from providing information for queer communities, it also provides information for the wider societies. And soon, this zine became a kind of old-fashioned because who wants to look at HIV/AIDS? Then a lesbian magazine called Les Plus started to emerge, and a gay magazine called Gay Spot started to emerge. And they are pretty much like today's fashion magazines or lifestyle magazines, with a little bit of funding support from HIV/AIDS funding, and with some coverage of HIV/AIDS issues. And then websites started to emerge in Chinese cities in the 1990s. Early websites all disguise themselves as kind of HIV/AIDS websites, or the kind of knowledge expertise websites, which provides people with information about disease control, about identity formation, and news from all over the world. And then there was dating apps. So a couple of days ago, Chinese dating app which Blood, which is on the right-hand side, has just finished its stock market release. In the New York Stock Exchange. But this actually but the official function of that website in the Chinese government discourse was a kind of HIV/AIDS prevention application. So in a way, HIV/AIDS prevention became an excuse for the existence of different forms of community media. But meanwhile, they also serve to stigmatize gay identities and communities in particular ways. So here, I know that I'm aware of the time and I'm drawing it to a conclusion. So a summary. So here we're talking about the role of gay community medias in public health communication and health activism. The lessons we need to learn is that, yes, there are stigmatizing discourses in those global pandemics, and those discourses creates certain types of identities and communities. However, the real development, the real life development of all those identities and communities often go beyond the public health discourse. They often actually talk back to official discourses and create reverse discourses. In a way, actually, some certain minority communities actually can use those discourses to articulate their demands for identities and rights. Another lesson that we can learn is that there is a need to think in terms of communities, in terms of collectivities and publics. So yes, public health intervention schemes currently, at least in the UK, is pretty much focused on the kind of isolation. So stay at home and keep yourself away from others. There is an obsession with an individualized type of identity, with a kind of privatized life of intimacy. How about that we think about public health policies in terms of communities engagement, in terms of community care, in terms of people helping each other and caring for each other? So that's probably also another thing that public health policies have got to articulate. And meanwhile, we should also recognize the importance of media, in particular, media used by, for, and in or among the minority communities, and how those media can articulate concerns and construct communities and help communities navigate through a public health crisis like the one we're experiencing now. That's all for my talk. Sorry for going over time.
Thank you, Hongwei, for this very, very insightful overview. And well, without further ado, I'm handing over to Zai before we engage in a more conversational manner.
Okay, thank you, Gero. Thank you, Hongwei, for this very in-depth and informative overview of what have been going on in the past 30, 40 years, right? And also thank you for reminding me my age that
What's my age?
most of the things that you've talked about, I kind of at least have some memory, right? The very maybe I didn't know about the hotline. I mean, I was too young back then, but the 朋友通讯, the friend exchange, it's something that I've seen, and going back to see these materials while I was preparing this response, very loose response. It's very interesting to see the kind of both the specificities and the kind of global resonance that this particular community or communities in Chinese context have changed over time, right? And it's very interesting to think about the kind of emergence of all kinds of like sexual practice-based identities, the emergence in tandem with kind of China's participation into the global economy and into, for example, the WTO, right? And the global funds that comes into China as prevention funds and for forming not only actually not I think not only communities that existed anyway, but most importantly NGOs that were created in a different context, especially urban context, I guess. What I would like to do maybe is actually I prepared some notes without knowing exactly what you are going to talk about, but I think in the talk there are some interesting things that are more interesting than my own notes, so I will kind of try to woven them together. So the first point is the kind of comparability, let's say, between COVID and HIV in the particular sense of the othering of the virus, right? So when COVID just started in China, of course, it has been really very much imagined as this thing that happened somewhere else, right? Even though China is no longer, actually in the current moment, no longer a very strange other, but still this long tradition of othering China kind of had its magic to make people forget that China is part of the global community, very much so, right? And very soon, for example, in the case of Italy, which is the first country I think that banned air travel with China in Europe, and there were a lot of discourse that came out back then, basically kind of imagining it was not imagining very much like the virus is there, but it's a virus that can be imported, right? Exactly in the kind of way that you talked about how HIV was said to be the foreign disease. But I think there is a crucial difference, is that in the current moment, the travel is mutual. So there are a lot of Italians go to China to do business. I mean, it's not a coincidence that Lombardy was the most hit place because of the kind of very frequent air travel between China and Italy, right? So this one is mutual, but imagined as only imported from this other China. In the case of HIV, if I understood from your presentation, it was largely imported. but
there was the history is still unknown. So the first case was an imported case, was a African American. So there was a lot of panics towards black phobia at that time.
Yeah, but I mean in China, not in the United States. Yeah, in China. I mean, in the 1980s, the kind of travel was not like it's not equivalent, right? There were only so many Chinese who travel outside, and those who travel in, right, through not people, but like as you said, blood donation and so on and so forth. This reminds me of so what is happening in, for example, in Latin America. In the case of Brazil, for example, the COVID is very much carried into Brazil by the privileged class who could afford to travel. There's a case, very sad case of this, I think from São Paulo, upper middle class family who came back from ski holiday in Italy and carried back the virus, and then the domestic servant got infected. I mean, but the whole family is infected. But then that lady died, but the family survived. So I think if we give to these nuances the othering of the virus in both cases. Needs to be localized in this very specific historic moment, and also vis-a-vis class, right? The other can be the minority, can be the marginalized minority. It can also be the privileged class, right? The other here that doesn't necessarily attach to a kind of hierarchically lower position. Let's say, in terms of the carrier of disease and of the virus, and also what is interesting in the another maybe let's say difference between these two is that the most affected community in both pandemic. Let's say in the case of United States and Britain, right? The Black and Latino in Britain is the how do you call it? The BAM, right?
BAM.
BAM community. In COVID, these are communities who are both disposable and essential. Right, they're mainly the kind of workers that provide the most essential sustaining work. That despite the lockdown, they still need to work to make the society barely functioning. But in HIV, I don't think they are essential, right? They might be disposable, but not essential, and that gives a different twist to that pandemic. This is the first point. Okay, and the second point. Now I just abandoned my previous note. I will just read from the note I noted down from when you were talking. So the other one that is very interesting in the specific context you talked about of the emergence of LGBTQ 同志 M2M communities in China. That is in tandem with the kind of global fund that comes into China and demands a community. Basically, the creation of the NGOs on the kind of administrative level are entity created to receive the money, but then to kind of to both justify and to also to put the fund into usage, these kind of communities have to be called upon, right? And this act of called upon these communities. I'm interested in you mentioned the kind of the category they used, M2M, man have sex with man. That is both a description of the deed, right? What people do, and somehow an identity. I don't know how many people identify with that, right? People might identify with LGBTQ and 同志 and so on, but I don't know how many people say I am M2M, right? I might do that, right? So anyway, there's a collision between being and doing there, right? And I'm wondering what it is that community that have been called upon, right? You mentioned the technology of the self, Foucault's idea that is very connected with the confessional, right? So we really have to, I think when we talk about these identity issues in the global south, actually I don't know how much we can still put China in, or which China that is the global south, right? Which part of China, or which kind of reality of China is the global south. But anyway, this kind of identity needs to be de-universalized, historicized, and also you mentioned that how it talk back, right, to not only to the governmental identification, but also to this kind of global mainstream. So I would be more interested to hear more about your. I know you've done a lot of field research, and you are very close with the community activists and so on. What kind of like talk back, right? That people have been articulating. So but anyway, let's go. If we go back to the confessional, I noticed on the 爱知 newspaper that you showed, there's a question. There were a lot of questions, right? One slogan is 成为你自己, right? Become yourself. This is very this is the kind of a concrete example of the technology of the self through the confessional, and then the self emerge as such, right? And because this is in the context of HIV prevention, it's not surprised that these identities that were formed in that particular moment are very attached with HIV stigmatization, right? The formation stigmatization actually work hand in hand. I guess the lesbians have a say on this, right? Because it's not exactly happened in the lesbian community, because the stigmatization is very much attached to M2M, right? And so on. So this is the third point, and then maybe the kind of the last bit, and I will stop. Is in both pandemic, I think one inequality that stands out very much is intersectional, in the sense of it's intersectional, but it has to be emphasized that there's a very strong class inequality, right? And the class in different contexts, of course, it attached to Black Latino community in the United States, the BAM community in Britain, and in China, I guess it's the migrant workers, right? that coincided with all this history, right? Coincided with this very narrow period of 30 years of China's rapid urbanization and kind of participation of these marginalized group into the city, and migrant workers become like sex workers, and they work in factory, but they also work as sexual workers, and they don't necessarily articulate this, or they don't actually identify with any of these identities, right? So intersectional in the sense of that they are always attached to racialized or kind of in China, how would you call this? Is another, I guess, another like urban rural kind of division. Yeah, so that's more or less my response. Yeah, thank you.
Can I respond briefly? So,
of course, I was just about to say, Hongwei, if you want to just have a response to this, yeah, sure.
Yes, I agree with all your comments, and I think all those comments and suggestions are wonderful, and they'll be really helpful for me actually to write down this paper, write down this chapter by taking into different facets. But my short response will be actually on the MSM identification that you talked about. I remember when I was starting to do my fieldwork from 2006, 7-ish, etc. Every time when I go to China and there is a kind of conference for MSM or conference for HIV/AIDS, etc., and I had to go to those conferences actually to meet my research participants. And at one stage, I was really bored. I was like, can't you just have a kind of, well, gay and lesbian LGBT conference without MSM or without HIV/AIDS? But of course, without it, you wouldn't get funded, and probably you wouldn't be allowed to be held. So that was just the pretext. So, but in some of those conferences, they invited different gays, lesbians, transgender, intersex people, and the list just proliferates, and people recognize that there are different sexual and gender minorities, and they were all affected by this disease. So we need to address those differences. But meanwhile, there are also community groups, medical professionals, government officials invited to those conferences to hear about the experiences, which in a way creates a space for dialogue. Then, for a long time, my research actually didn't touch on HIV/AIDS at all, because like some of my research participants or whatever, we think that HIV/AIDS is a stigmatization of gay identity and communities, etc. And it was only until, in the past few years that I started to realize, in fact, you need to look at the political economy of HIV/AIDS to understand the current situation of gay and lesbian communities and identities, etc. But a short response to your question is, yes, there are identifications of MSM identity, and that can be a liberating identity for some, because not everybody actually is comfortable enough to come out, and not everybody identifies gay, lesbian, transgender, etc. So for them, as MSM is an identity that doesn't point to a sexual practice or sexual identity. So it's practice without identity, if you like. So for some in a homophobic society, actually, this can actually create a shelter. We are innocent. We're not those gay people. We happen to have sex with people for different reasons. Some people actually were at those conferences. Some participants openly identify, I'm an MSM, but I'm not gay. So, however, other people also identify, I'm gay, I'm not MSM. So of course, identification is a complex process. But the most amazing thing is that all those identities and identity categories were laid out to people through those international conferences, through publication, through public health campaigns for them to choose from and to identify. So that's the most amazing thing. Yeah.
Thank you. So I'm gonna try and be very, very brief, but I have three thoughts that I would like to ramble about for a bit, and then have the two of you comment on them, and then I'm going to open up the floor to questions from the audience. And so the first thing that I wanted to say is that I was fascinated by that part when you talked about exactly this MSM identity, because well, being socialized and living in a German context, it's very interesting that this kind of identity or this kind of label is also still being used here and specifically in a health context, because it is being used as a supposedly, well, objective and descriptive category that is used, for example, if you want access to certain kind of healthcare. So, for example, if you want to get access to PrEP, you basically need to identify to your health insurance as MSM, or vice versa. You are excluded from donating blood if you check the box, I am MSM. And I don't know, that, you know, just as a comment, that this is not in a German context, I would say, and this is totally not a category that is being used as an identity, but it is a very powerful category that you kind of have to strategically inhabit, sometimes well, because you have to, otherwise you would be lying, and you could be charged with you know, trying to hurt people, or because you want access to certain kind of well, healthcare, for example. That's the one thing. And the other two things that that I was thinking about when I was listening to your talk, or to the two of you talk, well, first of all, when I heard this historical trajectory that you described, Hongwei, I thought, you know, oh, it's really, really tempting to, you know, to do of course, a very, very dodgy comparison between, oh, well, you know, this there is an identity that emerges from a medical discourse, which, say, in Europe, you see at the end of the 19th century, where it's sexology that creates certain gay identities in a different sort of way, of course, but still. And then you mentioned, right, Foucault's reverse discourse, which you could say, well, in Europe and in the West, that happened in the early and mid 20th century, and so on and so forth. So I felt this temptation of saying, oh, right, you know, I could totally buy into this narrative of modernity, maybe, you know, where something's happening in China in a very brief period of time under, of course, different conditions, but still it's kind of that same thing, which of course it isn't. And I was wondering what your thoughts were on this, because also, you know, I was thinking in terms of how, and I don't know much about this, right? But what I know from you, Zai, and from other people, that you know, in terms of how activism, queer activism works in China, you know, is it part of something that is global gay, global queer, or is it something that is specific to, well, a Chinese context? And this also obviously goes for other particular contexts where a different history has happened in different societies in the background. And I was wondering maybe if you have more thoughts on this, because I found it striking how easy it would be to go with this narrative that this is that over the 20 years, basically what's happening is just a process of modernization that, you know, it took us 100 years to accomplish, something like that. Mm-hmm. And the third thing, thinking HIV/AIDS and COVID-19 together, I was thinking, so a few words that came to mind, or a few concepts, were hygiene and purity, and then stigma, which you also mentioned, because one of the things that strike me, and also, you know, Zai, reading your blog article on the epistemic condition, which is a reaction to Badiou's on the pandemic situation. For those of you who haven't read these two, or basically Zai's article, just Google it, search for it online. Yeah, I was wondering if you could comment on that idea of hygiene and purity, which buys into, or which works towards this dynamic of stigmatization, towards the racism, towards the homophobia, because, you know, in HIV, in the history of HIV/AIDS, you've got this this association of HIV as a gay disease, which is connected to, I don't know, perverted sex techniques and all that. And then in COVID, you've got this association of, you know, the supposedly dirty Chinese, right? And that. So yeah, these were the things that came to mind, and maybe you could, yeah, I was wondering what you had to say about that.
Okay. Okay, sure. Thanks for your question. It's really fascinating to compare the kind of HIV/AIDS and history of homosexuality in different historical and cultural contexts. I acknowledge that there are a lot of things in common, and we really need to look at actually the history of Chinese homosexuality in a transnational context, probably thinking about a kind of global history of sexuality. Of course, Foucault tries to do that. Foucault, I mean, even came up with terms of ars erotica, supposedly in India and China, and what is that? Xiang sex studies, yes, which is supposedly to be a Western construct, and so on and so forth. So the particular period that you are talking about from 19th century to 20th century was important for China, because although my talk actually primarily focuses on the last 30 years, but I didn't suggest in any way that homosexuality only emerged in the last 30 years. If anything, I should have used this term re-emerged, because people believe that, in Mao era, supposedly sexuality didn't exist. And it was only when China opened up to the West in the post-Mao era that homosexuality re-emerged. So whenever I talk about emerge, just think in terms of re-emerge if we are thinking about this longer historical trajectory. So yes, there was a tradition of homoeroticism in China. It was understood in different ways, but not in such an orientalist way of kind of ars erotica. It probably should compel us to think about sexuality in different ways. What is sexuality? At the beginning, at the end of 19th century and 20th century, as in today's Europe and USA, the scientific discourse actually about homosexuality also emerged in China through translated discourse. In fact, Magnus Hirschfeld visited China actually with his Asian partner or gay partner at that time. And so all those works by Hirschfeld, by Freud, and by Alice, and so on, were translated in China, into Chinese at the beginning of the 20th century. And they were read and they were accepted in the popular press as well as in the field of medical science, etc. So a translation at that time emerged called 同性爱, literally same-sex love. And 同性爱 is an interesting thing, because people on the one hand recognize that it is a kind of disease, a pathology. But according to Zhang Zilan and other people's Conventions research, actually, at that time, 同性爱 was actually understood in a more open way than in a Western medical science. For instance, doesn't necessarily denote an identity, and it is a kind of mutable, actually, a transformable type of things. And Chinese doctors and medical professionals even infuse the Chinese concepts of the qi, the different types of energies that can transform forever, and so on and so forth. Yet, in other words, there were actually Chinese understandings of homosexuality that probably slightly differed from the Western context during the same period of time. And also even during the Republican era at the beginning or in the first half of the 20th century, homosexuality was practiced, and although was problematized, but it was still practiced actually in theaters and among urban elites as part of China's historical traditions, and so on and so forth. And then the repressive hypothesis starts, which the Chinese version was that the Mao era has eradicated all the homosexuality, and then all the people have to be made into sexless beings, etc. And then at the end of Mao era, when China opened up to the West and homosexuality emerged, etc. So that was a Chinese version of sexual repression or repressive hypothesis, which are criticized in the first chapter of my book, Queer China. But here, I think the point that I'm getting at is that, yes, Chinese case or the history of homosexuality occurred in a global context with transnational flow of knowledge, expertise, and people. the particular history that I'm looking at in the post-Mao context has its own particular trajectories, because it actually was very much constrained by China's government policy attitude towards homosexuality. It was impacted upon China's socialist histories and socialist understandings of what is a subjectivity and the place of sexuality, if there is such a thing, in the making of human subjectivity. And it is admittedly a very complex issue, but I would actually argue both against the kind of global queering or global gay thesis and a kind of romanticized indigenous type of kind of sexual orientalist discourse saying sexuality in China would be completely different from the West. That wouldn't be true either. So in fact, we should be looking at actually a global history of sexuality with local mutations and transformations and see how China's distinct social context and historical trajectory have shaped identities and communities in specific ways.
Thank you. So, Zai, maybe if you want to respond to either that part, or to maybe you could also just respond to the second part about, you know, hygiene, purity, stigma, whatever you.
Yeah, I let me try. The MSM again. Go back to the MSM question is it's very interesting. In the I was so in one of my note that I didn't read out. There's a kind of the difference between the online persona and the offline persona, right? In online, I mean, from very early on in Beitong and in Boya and all these forums, you have very specifically articulated self, let's say, right? Very specific fetish, very specific sexual preference. Not only, I mean, not only limited to sexual preference, but you know, it's very clear who this subject is, right? And then in the offline kind of conversation, this, I don't know, you have this experience, Hongwei. People would always say, "Oh, 他是那个, he is that." If you translate into English, he's that. Are you that? Right? That's that. So without articulating specifically that identity, that I like the verb you use, the emerge, right? Emerge and re-emerge. But what interests me in all this kind of the theoretical aspect of this question is, what is the thing that emerges, right? Does it change? Does it modify it into a different thing because of the very core? You mentioned Kang Wenqing's work on the kind of more historical account of what can be broadly termed the homoerotic practice. There were different categories that in that many works, some works try to basically make an equivalence to what today known as LGBTQ, right? The Longyang or the Duanxiu and so on and so forth. But there's always, I think there's always a conceptual inequivalence that exists in these different categories. And this is one question. The other question is how people relate to them. So the question of identity. Right? Of course, sexuality. If we in the Foucauldian sense, despite what he has to say about India and China, which is completely uninformed, sexuality as the truth of the self. That is something that I think in the particular context of China and global South, in general, it's a very double-edged. How do you call this? Double-edged sword, right? It is both a bless and a curse, I think. what is that truth, right? That is called upon to emerge again. And this, let me try to do a conceptual jump. This relates to the question of purity and dirtiness, right? So there we can see the kind of the idea, at least in the mainstream discourse of coming out, so on, sexuality as such, is very linked to the purity of identity. So if you once you are gay, right? Which make the MSM interesting, because how many times you have to have sex with a man in order to be MSM, right? How many times? Once or many times? How many times, right? This kind of and again, like the question the trans community ask and really destabilize is the certainty of all this of all these questions, right? If a trans man have sex with man is what, right? What kind of identity categories that we can talk about? So I'm as I proposed in that response of the epistemic condition. In the end, that I just left the cryptic note of the epistemic unhygienic, right? I guess I personally am more interested in the kind of messiness that is on the ground, online, offline, how people understand themselves, ourselves, that are not necessarily bound to a pure truth of the self. That is the project of modernity, the kind of question of sexuality that becomes so it becomes so suffocating as sometimes as well, right? Yeah.
Thank you. So now it becomes a bit exciting technically. So what we're going to try and do now is, so I would like to open up the floor to the audience. And as I said earlier, I would like to ask those of you who have questions to type the question in the Q&A function. So for the gems, it's the F und A function at the bottom of the Zoom window. And then I'm gonna read out the questions to Hongwei and Zai, and forgive us in advance if we can't answer, or if they can't answer all the questions, if we can't take up all the questions, but we're going to try and do our best. So this is this was discussed as one of the most practical means of going about this. So has somebody, so there, I don't see any questions yet. So does this mean that nobody can type in questions, or does this mean that nobody has a question? Louisa, can people use the Q&A at the moment?
They should be, yes, they should be able to use the Q&A.
Okay, so
I just enabled the chat.
should work. Yeah. Okay, somebody's saying I think so, should work. So please shoot away anybody who's got a question or a comment.
Or to break the ice while people are talking, and I respond briefly to Zai. I think that Zai and I actually share a lot of the thinkings in common. I completely agree on the necessity to think out of strict boundaries, of identity boundaries, and embrace this messiness. And I would argue that in what many queer subject formations, probably I can't generate to say that it's everyone, but in the kind of gay subject formations, well, on the case of many people, it's actually pretty messy than we thought for example, so people would actually identify themselves to be gay in certain contexts, but not in others. So it's kind of very contingent identity and very relational. I may come out to my best friends, but I may not come out to my family because of this or because of that, etc. And online and offline is, of course, one of the other situations that demarcate those messiness of identities. And with regard to the technology itself, of course, there is a kind of neoliberal, increasingly liberal and neoliberal type of subjectivity that structure gay identity formation at the moment. But we can also see traces of other type of subjectivity, such as the Confucian type of subjectivity, the kind of Maoist socialist type of political subjectivity. I think the core thesis for my Queer Comrades book is exactly, actually, when we think about the post-Mao subjectivity, we shouldn't think about it completely separate from the Maoist subjectivity. And the particular type of political subjectivity, the comrade subjectivity in the Mao era, informs the queer subjective formation, really informs of any subject formations in the post-Mao era. So that if there is a kind of cultural specificity, this I would see that this underpins many political subjectivities and social movements in China at the moment, how they have actually drawn on the kind of socialist political movements and subjectivities actually for today's youths. Yes, so the short answer is that those identities and subjectivities are not clearly cut and they're always messy. However, in China, increasingly, the queer groups are propagating the coming out and be yourself discourse, which is worrying. There is a question.
Right, we have a question. So the question is, Renate Baumgartner is asking, so she's wondering about NGOization in China. Were there any NGOs from the global north trying to steer or educate regarding MSM and HIV? And if yes, how was this done and how was this dealt with by the Chinese communities? Mm-hmm. She remembers that this was a big topic, for example, in Russia, and it was seen very critically by the queer community.
Yeah, yeah. And I recently saw a film called East and West Sexual Politics by German filmmaker. So basically, it's in the Russian context. In China, I think that there was a kind of acceptance of Western way of working for different reasons. So let me put it this way. So all the NGOs, once they were funded by Chinese government and and international funds, they have to receive trainings, or there were standard way of education and advocacy. And in those education and advocacy sessions, certain techniques and terms are taught. But there was also recognition of the local context when you should actually recognize the cultural specificity of China. One approach that I would say, which is the double-edged sword, which is a kind of participatory communication approach, which is to encourage gay people actually to talk about their own stories through the use of videos, through the use of recordings and diaries, etc. And that proliferated a kind of an urge of confession, to use the Foucauldian terms. So people start to confess their identities and so on and so forth. However, I'm a cultural studies person, so basically my way is always to look at how those policies and practices are implemented in real life and by different people. So I see actually more uncertainties than certainties. Yes, there are standard protocols of international ways of working, international ways of calling people LGBT, LGBTQ. There is agenda setting in terms of global South and global North information flow. However, in reality, the practices are more varied.
So I do so, yeah.
Just to that question, I mean, I'm just talking out of my head. From afar to observe that very short period that Hongwei identified from 2004 to 2014, right? Basically 10 years. I think it's both ends. So there's there is of course the bright side that that these global north, if you want to call that, or like embassy space, actually provided a lot of space for you know, queer festival, or for topics that are deemed sensitive in the broader context to be discussed. I think that many activities happen in these more or less restricted places. But at the same time, we also need to relate this to a kind of, to put it very, very broadly, a kind of Pax Americana. Right? There is an attempt to bring China into the global capitalist system as like to kind of not educate, I wouldn't say, to socialize that country into the capitalist present in our term, right? And I think Lisa Rofer's work on neoliberalism and the creation of desiring subject in China is a very important work to look at that history. I see more question, but let me just add, if we put the historic lens a bit broader, just now Hongwei also mentioned Hirschfeld Magnus. He traveled to China in the 30s, right? And met there, or already met, I think his name is Li Xiu Tong. His kind of boyfriend basically would appear in some photos with him together, although they have very I think the Chinese guy was his student, and then he basically, in some accounts, he encountered a society in which same-sex relationship was not seen as a sin, at least not in a kind of Christian sense. That prompted him to work even deeper onto this question, right, of homosexuality. So even in the kind of early work of homosexuality in the West, is already entangled globally, right? So if we talk about the entangled history that emerged re-emerged, use Hongwei's word, in early 20th century, if we look back in early 19th century, it's already very much entangled. And in arts and literature, all these Europeans who went to Tangier in Morocco, right, to Japan, Ulaanbaatar in Japan, so on and so forth. These maps that we can all draw. Eisenstein in Mexico, right, for example.
Okay, so we've got another question from Beatrice Polivanov. She would like to ask about the differences between on and offline forms of identity construction through media. I believe it's important to think about the particularities of different environments in terms of anonymity, whether on and offline. Could the panelists comment on the idea of being anonymous, either as a number on statistics or a dating app attached to an idea of safety, of being more free to express oneself, but at the same time of being invisible?
Okay, so that's a challenging question. I agree with the necessity of thinking about particular forms of media and particular context in its specificity. And it's very hard actually to generalize what media do or do not do. So here, I mean, I'm really influenced by the kind of Deleuzean assemblage type of thinking. So it's not media that has intrinsic qualities or virtues of doing something or enable something. It's really actually how particular forms of media forms a contingent assemblage with the people and with the social context that they're forming. So if we see this context, then yes, there are actually bigger social, political, and cultural contexts that shape all those configurations. However, there are also specific contexts and specific decision-making that might actually shift the assemblage in different ways. And I do not see the anonymity actually as a kind of, well, it can be a kind of refuge, it can be a type of fantasy, it can be a type of identity disguise or masquerade, etc. But I would really look at specific context and what artifacts and embodiments they engender.
Sorry?
Yeah, I think the idea of anonymity, go back again to what I've been very annoying to insisting on the kind of the truth of the self, right? What does an anonymity, especially in this kind of online offline context, what is the purpose of the online presence, right? We all have multiple personas, and anonymity is probably one of them, right? Of the persona. We could do a sociology of this as in terms of safety and so on. But if we, for example, we look at cruising, right? Cruising spot in urban space, like let's say in Beijing, it's not that anonymous. The people like hang out there and know each other, and it's not that safe, right? Either. So it really depends on the kind of specific context. And also, I doubt how many people actually in this kind of dating app and forum anywhere would be themselves. Right? Would anyone do that? Like, would anyone? There's the joke Ronnie Chan made, kind of bad joke, but a funny one nonetheless, about his mom. He said his mom would, when she learned how to use the comment function in YouTube, she would go and comment on people's crazy trolling comments, but the problem is that she registered with her real name, right? And that's the joke. Like, you don't do that. Who does that? I never put Zairong Xiang in my profile, right? Dating profile. So
thanks. Renata has another question. I would have another question about the involvement of Chinese social credit system in health status and care, and sexual orientation. Is there any connection, or what could it mean in the long run for LGBTIQ people or people with HIV to be out in this context?
That's actually a challenging question, because I actually don't know much about China's social credit system. And also in Western media, there has been a kind of obsession or even myth about how China's social credit system and surveillance system have monitored individuals. I think, well, as far as I can tell from the people that I know, the social credit, well, if social credit means social welfare system, then yes, people do have a lot to worry about. But if it means surveillance, yes, people are bothered about it, but probably not so panicked about that in the West. I would say, I forgot the question actually, sorry. So probably Zai.
Yeah, so I want to echo with Hongwei. I think it's not completely a farce, but it's pretty much a mediatic sensationalism, as how severe it is, right? Because if it were really in place as it has been portrayed in media, then COVID wouldn't have been so complicated to trace. Then the big data can just do the magic. But apparently this magic didn't happen, and they have to deploy this very medieval method of locking down a whole country of how many people, like 20 million, almost 20 million people in the heartland of China. So that in a way, I guess, shows that this is not really yet, hopefully never, a universally implemented system. And as far as I know, it has nothing to do with sexuality yet, right?
Well, to follow on that, actually, to transfer that into a more intellectual discussion, I think that actually points to our different attitudes towards the state in theoretical conceptualization. A German scholar, I forgot the full name, Nadia, wrote a book actually really reflecting upon the state phobia in queer theory and in a lot of Western critical discourse. How do we actually relate to a state? So in a neoliberal state, people tend to think, oh, state is this horrible thing, and it's a communist state trying to crush our freedom and so on and so forth. However, especially in Northern European context, there is a kind of, more trust in the state, or willingness actually to collaborate with the state, and then recognition that public health crisis, current COVID-19, for example, is a kind of universal problem. Only through the kind of state intervention can this problem be resolved. But of course, I'm not generalizing that everybody thinks this way, nor am I generalizing that different states in the world are functioning in different ways. However, theoretically, I think that the reflection towards the state about what the state is and how a state is perceived in different cultural contexts is important. In my slides, I talked about exactly through the kind of AIDS intervention schemes, Chinese queer community groups actually tend to be closer in their relationship to the state and in transnational capital. This doesn't mean that they're not critical, but this does mean that they see the state as a kind of both an enabling and disabling factor, while not being too paranoid about it.
Thank you. Then we've got a question from Paul Michael Atienza. Thank you for sharing your thoughts with us today. What are your current anxieties of health and well-being that continue to emerge from new media ecologies among the queer groups you focus on in your research? Does HIV/AIDS continue to be a topic of discussion within media forms, or other STIs, mental health, or other connections to economic, political contexts of their lived realities?
Well, sorry. I think, 2014, as I said, was a kind of important historical juncture when global funds were retreated from China. There were many reasons why it was retreated at this time. So part of the reason was China was believed to be strong enough or rich enough to solve its own public health problems. And part was that there were evidence that HIV/AIDS actually crisis wasn't that strong, wasn't that urgent in the Chinese context, or it is believed that with a free health care for HIV/AIDS people, although implemented differently in different regions, etc. So the problem has been tackled. So at the moment, LGBT communities focus on a lot of issues, while a lot of issues are also actually, in a way shaped by international discourses about same-sex marriage, about surrogacy, about parenting, about egg donor, and so on and so forth. So these agenda setting can be beneficial because it offers actually a way to talk about identities without addressing actually the without being politically explicit. However, they can also be misleading in that, well, I remember some of the queer activists have mentioned that actually in China, some issues are not that urgent, but since LGBT movement or international funding focus on this kind of funding, we have to deal with this issue. So that can also be problematic. But overall, the issues are more community-based, including domestic violence, including urban-rural divide, sex work, etc. So it's certainly more verified than before.
Zai, do you want to say anything to that? You don't have to.
No, I think Hongwei has said pretty much everything. The one worrying, slightly worrying thing is drug use that emerged in the urban community, gay especially, crystal meth, to be specific.
But that also has to do with the kind of drugs are totally illegal in China, although I mean, of course, it is practiced everywhere in the world. However, the government policy has created people's lack of understanding, lack of regulation of the industry. When drug use used properly can enhance pleasure and community and identity, etc. However, if the kind of public policy continues to ignore the issue, continue to criminalize it, and it's probably not good for the public health overall.
Thanks. So since there are no further questions currently, and we've only got 10 minutes left, I would like to give you, Hongwei and Zai, the chance to have the last words, a last comment, and maybe if you would like to answer one last question that came to my mind, but you don't have to comment on it. I was wondering whether, again, coming back to the current situation and COVID and the connection, COVID and HIV/AIDS, I was wondering, do you know anything, or what's your impression, what the impact of one on the other is? Because from what I've seen, even around here, but also what I've heard from other countries is that, for example, the COVID crisis has had a negative impact on, for example, accessibility to medication when it comes to the treatment of HIV and AIDS, or other communities that work in this sector particularly affected. I mean, I guess they are, but in what ways by the current situation? Yeah, so just that as a last idea and question, and then if you'd like, you can wrap this up. Maybe again, let's start with Hongwei.
Let's start with Zairong.
Oh, start with Zai this time.
The pandemic more than I do.
I don't know. I think so, but I don't know because the kind of the temporality is slightly different, right? My impression. I'm in Berlin, right? But my impression is that in China it's pretty much under control, and life come back to more or less 90% normality. I think it's case by case, region by region, context by context, and also different class, different community experience this differently.
Yes, I mean, I would agree with Zairong that a lot of people in China, although people are still worried that 1% or however much percent, but life pretty much goes back to more normal, and people wear face masks when going out, people go to public events. But certainly there are clear impacts. First, there are positive things, which is that after the ease of the lockdown, there is a proliferation of queer public events. This was pretty much because not that Chinese government has loosened its censorship, but that the priority with the pandemic and with other things have created a larger space for civil society organization. So for example, in the past few months, whatever, I have attended a lot of online seminars, events, etc. I have also followed the Shanghai Shanghai Pride, which is kind of one of the very few actually prides that actually took place offline. And of course, they have to scale down the events. They have to enforce certain social distancing measures, such as providing face masks and sanitizer and so on and so forth. But at least a lot of events have started to happen, have people started to have a sense of normality and there was also a stronger sense of the communities in different cities that I've observed. For example, in Wuhan, during the pandemic, at the height of the pandemic lockdown, a lot of HIV/AIDS patients or people who live with HIV/AIDS had no access to drugs because of the lockdown situation. So local LGBT groups really helped them deliver drugs, swap drugs, and so on and so forth in a good way. So in this way, actually, it is the community groups really helped when the government or when the public health policy actually haven't attended to those issues. Another example that I've written about is a kind of anti-domestic violence campaign by some feminist activists based in Wuhan, but communicating with other feminists all over the country and even the world, which is basically they call on actually the gendered aspects of the lockdown situation. We're realizing there is a rising domestic violence, or kind of this could be an issue. So they started an online campaign calling people to raise awareness, to combat this issue, to report the cases and providing free counseling services, etc. And what I do see is that there is a kind of burgeoning or booming civil society actually during this particular crisis. And it is probably because of the government attention or other reasons that these initiatives actually have got to develop in their own ways, which is a good sign. So at the moment, actually, I'm looking at several case studies. One of them was the kind of feminist activist groups actually in Wuhan or in China during the pandemic. And the other was the kind of queer activist groups, including the running of queer community hotlines and community radios, broadcasts, and so on and so forth. And see how this pandemic might have been an enabling factor for the community building and identity construction.
Every gay man is watching old sisters braving the wind and the waves, which is dubbed as the World Cup of the gay man in China.
Mm-hmm.
That's another
situation in Germany, Gero.
Sorry?
What's the situation in Germany? Or
well, I mean,
answer your question.
To my question, but then I also want to wrap things up and not leave people here. But I mean, it's strange. I mean, particularly while talking about the impact of COVID on the queer community, of course, you know, a lot of the things that you just said also just happened here from, of course, a lot of, public events have just been cancelled and communities are struggling to still, for example, organized pride parades. They are. I mean, a lot of things have gone online, but also Berlin, for example, already had its kind of subversive political pride parade. And in a way, it's nice to see that, you know, the whole commercialization of the idea has been cancelled, because that can't happen, but still people walk the streets. So that's good. And I've seen a lot of online organizing and all that. But at the same time, I mean, one thing, for example, that's just been happening very locally is that, for example, the testing stations for HIV have basically mostly been closed down because they say they're busy testing for COVID. So I also see, you know, areas where it's become harder to get access to certain, necessary forms of healthcare. And but generally speaking, the situation, I think, is fine, and people are finding very, very creative ways of, well, of still being visible. But it is being discussed that, you know, this is basically a year of non-visibility, at least when it comes to the mainstream, right? Because it's becoming really hard to be heard and to be seen and to remain seen, and not just being pushed to the margins and talk amongst each other.
Mm-hmm.
Yeah. Cool. Well, thank you so much for this, and I'm glad that we could end on a positive note. that this whole situation has also led to new energies and emergent forms of activism. Thank you so much to the audience for being here and for sticking with us, and for your questions. Thank you to Louisa for technical support in the background.
And Robert, everybody.
And to Robert for organizing everything, and of course to Hongwei and Zai for being here with us and for sharing your thoughts.